My name is Barbora Paldus and I'm an Endocrinologist and Research Fellow with the Diabetes Technology Research Group here in Melbourne, Australia. In this short video, I'm going to give some strategies for managing exercise in type 1 diabetes on the Medtronic 670G hybrid closed-loop system. So managing exercise in type 1 diabetes can sometimes be a little bit challenging, and part of the reason is that different types of exercise can have different impacts on blood glucose levels. Aerobic or moderate intensity exercise typically lowers blood glucose, whereas anaerobic or high intensity and resistance exercise typically increases blood glucose. In mixed aerobic and anaerobic exercise, this can cause either, but it's important to remember that in all types of exercise, delayed hypoglycemia can be an issue. Other factors to also consider are competition stress, heat stress, repeated exercise, and recent hypoglycemia. This table summarises some of the exercise strategies that can be used in open loop or conventional pump therapy and hybrid closed loop. They are divided into contraindications, pre-exercise insulin adjustment, pre-exercise glucose aim, and post-exercise insulin adjustment. So starting with pre-exercise bolus adjustment. If a meal is to be consumed 1 to 3 hours before exercise, a reduction of 25 to 75% is recommended for both types of therapy. For pre-exercise basal adjustment, for open loop, a 50 to 80% reduction 90 minutes prior to the exercise until the end of exercise, and in hybrid closed loop, a exercise target or a temp target to be set 1 to 2 hours prior to the exercise until the end of exercise. If a pump is to be disconnected for contact sports or because of hypoglycemia, even with basal reduction, it's important to remember that it needs to be suspended, particularly in hybrid closed loop, or the ongoing insulin delivery can affect algorithmic calculations. For pre-exercise glucose aim, a reasonable starting glucose is 7 to 10 millimole per litre, but of course this can be individualised. And if it's less than 7, carbohydrate is recommended, but it's important in hybrid closed loop that the carbohydrate is given as close to the exercise as possible so that it doesn't trigger an auto-basal increase. If the glucose is less than 5, then of course treat and recheck and don't start exercise until it's greater than 5. For pre-exercise glucose levels of greater than 15, check ketones, and if greater than 1.4, exercise is contraindicated. For post-exercise insulin adjustment, a reduction may be needed for bolus in open loop, and for post-exercise basal adjustment, a 20% reduction, especially for afternoon activity for delayed hypoglycemia. In hybrid closed loop, a reduction may not be necessary given the adaptive nature of the algorithm, but of course if someone has had hypoglycemia in auto mode after exercise, then of course a temp target can be set. So in summary, for the 670G, for activity that can cause hypoglycemia, set a temp target 1 to 2 hours before the activity until 0 to 2 hours after the activity. The temp target increases the auto-basal target from 6.7 to 8.3 and can be used in any situation where hypoglycemia is an issue. For high intensity or anaerobic exercise, a temp target may not be necessary. If exercise-related lows occur despite the temp target, consider suspension of the pump completely as well for some or all of the exercise time, and also consider additional pre-exercise carbohydrates, again to be given as close to the exercise as possible. If ongoing lows occur, then the person may need to switch to a manual mode and use a temp basal prior to the exercise and during. So let's look at some cases. So here we have Adam, a 50-year-old male who runs intermittently while coaching soccer. He normally continues in auto mode, but found he's having hypos during and after sessions. We recommend that he set a temp target 90 minutes prior to the first coaching session and stop after the last coaching session. He's found that this has stabilised his blood glucose levels. Adam has now started training for a fun run and is running approximately 8 kilometres after dinner. He sets a temp target 90 minutes prior to running, but found that he's still having hypos mid-run. We determined that it's probably the insulin on board from the recent bolus that's contributing to the hypoglycemia, and recommend he reduce his dinner bolus if exercising within 90 minutes of dinner. and he's found that this has helped stabilise his blood glucose levels. Here we have Laura, a 25-year-old female who started playing footy games on Saturday late afternoons. She's becoming hyperglycemic pre and during game, and then having hypoglycemia in the evenings. We recommend that before the game she continue in auto mode with no temp target, and add a small correction before the game and at half time. For after the game, reduce the bolus with dinner and set a temp target for the evening to target the delayed hypoglycemia. And the result? More stable glucose levels. Thank you very much for listening. I hope this has been helpful.